I'm helping to handle outreach on behalf not of the hospital, but of the doctors here who feel that they need to take a stand.
According to court records, the hospital is drowning in more than $1 billion in debt. It emerged from Chapter 11 in 2007 and tried to restructure, but it was never able to recover.
That we needed to take control of the message.
Sperling Greene helped us organize in the sense that they helped us get key physicians and key nurses to talk to the media, interact with both print journalists and radio and television in ways that I think none of us expected could happen. And actually, I would say Sperling Greene, this is a little bit of a cliche perhaps, but brought out the best in us, meaning got people who could speak well and put them in front of the camera or the microphone and really got the word out to the community.
We told them they needed to break the silence, and we counseled them to do something doctors don't often do, a press conference in front of the media. A day later, 100 doctors stood side by side in their white coats, ready to express their frustration, their anger, and their solidarity with the community.
Doctors somehow remain convinced something can be done to save St. Vincent's, and they don't want to accept proposals from elected officials to make it into some kind of urgent care center.
Well, it seems that doctors are upping the ante around the possible closing of St. Vincent's Hospital. A group of physicians who practice at the West Village Hospital are questioning the honesty with which the action to close it down is being taken. Let's find out why.
You know, it's a little bit mysterious to me how we can't know what happened, since the state kept saying they would discuss any option in the Public Health Council and publicly review the issues.
Because they've moved us forward in leaps and bounds. They work 100 hours a day if there were 100 hours in a day. And I really believe that our coalition wouldn't have moved forward so fast if it hadn't been for them. Their contacts are unbelievable. They work with the media. The media knows them to be true, and we know them to be true. They stand by their word, and they're working right now to continue this coalition, and I would like to thank them for the work that they've done because we really appreciate it. Like I said, we'd be nowhere without them.
Yes, the hospital closed. I think that was virtually inevitable. We started too late. I would say my biggest regret is that we didn't get Steve and Karen in with us, Sperling Greene in with us 3 or 4 months earlier. I think the outcome could have been quite different. But it did close, but the campaign goes on, and they are continuing to help us.
We're the attorneys here for the Coalition for a New Village Hospital, and we went into Supreme Court this morning to file papers.
These papers?
Yes. Yeah.